Are fossil fuels and petrochemicals making us sick? A new report from the New England Journal of Medicine says it's possible. Before we dive in, let's remember that fossil fuels are things like oil, coal, and gas, and that petrochemicals are the resulting chemicals from refining these fossil fuels. The report states that petrochemicals and fossil fuels can be a primary source of producing chemicals that might be harming our body's hormonal system. Let's break that down. Your body controls around 50 hormones. Think of things like testosterone or estrogen. Dr. Tracy Woodruff, author of the report and University of California, San Francisco professor of reproductive science, has spent decades studying how our hormones can be altered by our environment.
The chemicals, they're invisible, but they are having a visible impact on people's health.
When a body is exposed to endocrine disrupting chemicals, like a petrochemical, it can respond negatively. What could that include? Cancer, issues with brain development, infertility, and more. Fossil fuel and petrochemical production has increased 15 times over in the past 7 decades, and so have chronic illnesses that can develop after regular exposure to endocrine disruptors. Not everyone is equally exposed. Woodruff notes that communities of color are more likely to live along the fence line and feel more of these health burdens. This issue also adds to other disadvantages. These communities are more likely to be low income, have less access to medical care, and have lower rates of insurance. So what can one do to protect themselves? Woodruff notes a few steps, but it mostly involves pushing for better public health policy.
It's really important for healthcare providers to speak out on behalf of their patients and the population that there should be systemic changes similar to pharmaceutical safety testing.
For more tips and context about the research, read our article at ehn.org.